The grand challenge that we're going to talk about today is ensuring healthy development for all youth. And we're going to focus specifically on increasing access to early intervention services for Appalachian children who were exposed to opioids during gestation in order to prevent behavioral and mental health problems that can cause difficulties in adolescence. Next slide, please. This grand challenge focuses specifically on behavioral health problems in youth that are highly preventable, such as mental health conditions and behavioral problems that impact academic performance. The societal goal for this grand challenge is to reduce the prevalence of behavioral health problems in people 0 to 24 years by 20% from current levels, and to reduce racial and socioeconomic disparities in behavioral health problems by 20% from current levels as well. Next slide, please. The Grand Challenge goals have a number of implementation strategies that range from increasing public awareness to preparing a workforce to take on new and different roles in behavioral health. And across this spectrum, applying to public funding for prevention programs, community assessment and capacity building, establishing and implementing evidence-based programs, and increasing our prevention infrastructure and ability to monitor and improve access to these services. Next slide, please. Early intervention for children specifically who were exposed to opioids in utero is pretty important because fetal opioid exposure can increase the risk of behavioral and mental health problems in children and adolescents. And if we look at this as a large-scale population issue with the opioid epidemic, we see that there can be significant learning and behavioral dysregulation in affected children compared to their peers. And with the opioid epidemic, and we'll give you some data on this, there's going to be an increased need for investment in and access to early intervention services for these kiddos in order to reach the Grand Challenge goals of decreasing behavioral health problems in adolescents by 20%. I'm going to pass this to Terry.
Opioid use disorder, OUD, can cause many negative health outcomes for mothers and their babies, both during pregnancy and after delivery. Infants can be born with breathing and feeding problems, and mothers are often at risk of opioid-related overdoses. The CDC has provided a 5-point strategy to prevent opioid overdoses and harms, and they're taking specific actions to prevent OUD among pregnant women and women of reproductive age, and to make sure women with OUD get proper treatment. As you can see, from 2015 to 2016, the rate of overdose deaths among women rose 20%. Opioid use disorder has gone up more than 4 times among pregnant women, and from 1999 to 2014, 4 times as many infants were born with neonatal abstinence syndrome. Opioid use disorder during pregnancy has been linked to preterm birth, low birth weight, breathing problems, feeding problems, and maternal mortality. There are also long-term effects on physical development as well as neurophysiological impairments. The opioid epidemic has had dramatic impacts on mothers and their children. And studies show that children exposed to this have more significant cognitive ability impairments than those who are not exposed. As you can see in the graph, NAS, neonatal abstinence syndrome, and maternal opioid use disorder are on the rise. The rate of babies born with NAS are now per 1,000 hospital births was 1.5 in 2004 and has steadily increased to 6.5 in 2014. I will now pass this off to Gabby.
While looking into this grand challenge, some research done can be considered when thinking about the affected group outcomes. A longitudinal study done provided data on the cognitive recognition and the motor skills between 2 controlled groups. One group was made up of persons affected by drug use of their biological mother while in utero. The outcomes differed, and the non-drug exposed participants scored higher, yet the scores were not markedly worse for the affected control group. Next slide, please. Consequences of opioid exposure can be extensive. Children born to mothers with opioid or polysubstance use during pregnancy have a higher incidence of developmental problems throughout childhood and later in life. Some examples would be problems with aggression, hyperactivity, inattention, and social issues. ADHD has higher rates among children exposed to heroin dependency in utero. Next slide, please. Behavioral problems and poor academic achievement have been correlated to increased risk of drug and alcohol use in adulthood. So more tangible intervention and prevention will be useful in the curve for effective population outcomes. And now I'll pass this off to Miranda.
We have chosen to focus in on Appalachia because it's where the problem of neonatal abstinence syndrome is most prominent. Appalachia makes up a large section of the eastern portion of our country. It includes 13 states, 420 counties, and 15% of its 25 million residents live below the national poverty line. Even more specifically, we're going to zoom in on Central Appalachia, which is a combination of the areas illustrated in purple, yellow, and red on this map. Next slide, please. So the map we see here represents the levels of distress in Appalachian counties. The dark red signifies the highest levels of economic depression. And thinking back to the previous map, we can deduce that this concentration of darkest red is located in central Appalachian counties, which fall in the economically worst 10% of counties in the country. Next slide, please. So these maps look specifically at rates of NAS by state and county. And in Central Appalachia overall, 1 of every 20 babies is born with NAS. In each of these states, the darkest areas represent the highest rates of NAS, and as outlined here, the areas of each of these states that include those darkest areas are the parts of the states that reside in the Central Appalachian region. So while the problem of NAS extends beyond just the Appalachian region, it is the most impacted area in the nation. Next slide, please. So this is a continuation of the previous slide to include the 3 other states that make up the Central Appalachian region. And this goes a little more in depth and provides a comparison with the rest of the nation in terms of rates of NAS births. The US average of neonatal abstinence syndrome births is 7.73% of children born every year. And you can see here that the rates in Kentucky and Ohio are double the national average. And in West Virginia, rates are 7 times as high. And this is especially interesting because West Virginia is the only state entirely encompassed in the Central Appalachian region. I'm going to pass it to Emily.
So as you can see, there's a heavy burden of disease or of this condition in the Central Appalachian region. And early intervention is particularly important for this population. This is a fairly new syndrome in terms of seeing babies who are born with opioid addiction or opioid exposure. And so the evidence base for this particular population is still relatively limited, but we do know from many other populations that we have improved outcomes from early intervention for developmental disabilities generally and broadly. Access to early intervention services can be really difficult. Kids that are born with opioid exposure often can appear developmentally competent and then later on fail, or early on fail to qualify for these services, and then later have an emergence of behavioral difficulties around 18 to 36 months. So for this reason, ongoing screening from birth to 5 is really needed for kiddos who were exposed to opioids in utero to ensure a recognition of their needs and getting them access to these early intervention services. Next slide, please. Generally, there's a 5-point intervention framework for opioid exposure that starts pre-pregnancy with making sure that mothers are aware of prenatal substance use and how that might affect childbearing activities. Prenatal interventions, encouraging healthcare providers to routinely screen mothers for substance abuse concerns and making referrals for treatment for those who might need it. At birth, testing newborns for substance exposure at the time of delivery to identify babies that have been exposed in utero. In the neonatal period, looking at developmental assessments and provision of services for newborns, moms, and family as needed. And then in the childhood and adolescent years for ongoing provision of services for the child and family. And there's a very strong infrastructure that we'll talk about specifically to address 1 through 3, and to some extent point 4. Point 5 is a little more challenging because some of these developmental concerns can emerge later on and not be so notable early in life. Next slide, please. And so just to give you a visual of this, there's a lot of infrastructure in place to help pregnant women who are dealing with drug abuse issues in order to ensure that they and their babies are healthy. And that includes appropriate prescribing, making sure that prescription drug programs are monitored so that we know where drugs are being prescribed and where they're being used, making sure that pregnant women who have OUD have access to medication-assisted treatment and related services to help them be healthy during their pregnancies. and making sure that mothers with OUD receive adequate post-birth care, including substance use treatment and relapse prevention programs. There's a lot of structure in place to help moms through this, and we would argue there needs to be more structure in place to help them help their children through this as well. And then I'm going to pass this back to Miranda for some more data.
All right, so neonatal abstinence syndrome has an impact in multiple areas of society. It's part of an ongoing cycle of generational substance abuse. So when children are born with NAS, they're more likely to develop behavioral problems, which puts them at risk for later addiction. And then those children themselves who were born addicted grow up to birth addicted infants. And so the earlier that we intervene in this cycle, the more likely it is that we can prevent subsequent NAS births. In her book, Dope Sick, Beth Macy discusses how ADHD is one of the possible lasting effects of NAS and how it can provide eligibility for Social Security disability payments. So there are parents who push for this diagnosis with the hope that their child will have access to financial resources when they grow up and won't have to continue on in as deep poverty as their parents have. And this highlights the role that the high rate of poverty in Central Appalachia plays in the problem. Appalachian residents in general have less access to financial, medical, and substance abuse treatment resources. An article in the Journal of Rural Health points out that policy interventions are needed to address the disparities in access to treatment for those in non-urban areas to halt the increase in NAS and the tremendous humanistic and economic burden it poses. Beyond the impact of NAS on directly affected children and families, behavioral problems are also having a detrimental impact in classrooms today more than ever before. So helping prevent those problems through early intervention can improve the quality of education for all children. In order to achieve this goal, there must be greater availability and ease of access to treatment. The improvements that can be achieved through intervention for NAS can lead to an increase in justice and equity for the entire Appalachian region. Next slide, please. So there are already many well-established resources in the Appalachian region to support addicted mothers in navigating treatment and sobriety, but very few help them to also navigate treatment for their child who was born addicted as well. Some of these programs utilize peer mentors as support for mothers, and our idea is to build upon those already existing programs by including training for mentors to also help mothers locate and reach the mental, behavioral, and physical health support their child may need. By providing this support, affected children will be more likely to receive the treatment needed to ensure positive outcomes, which in turn reduces the stress for a mother already navigating a difficult situation, and which can reduce maternal stress, which also supports healthy child development. I'll now pass on to Terry.
One program that Miranda just talked about was the peer navigator and peer recovery specialist programs. Peer navigators are care team workers who are living a shared experience and shared community membership as the population they work with. There has been demonstrated success in HIV care, mental health, and addiction recovery with the peer navigation program. The benefits have been shown in increased engagement with and adherence to treatment. The reduced shame and stigma that can be attached to specifically mothers that are addicted and pregnant, shared wisdom and practical experience, and increased trust in the care team. Specifically in Tennessee, I interviewed a friend of mine who is a peer recovery specialist, and that is someone, this is straight from the state of Tennessee Department of Mental Health and Substance Abuse Services website, that they have to have self-identified as being in recovery from either mental illness, substance abuse, or co-occurring disorder. And they have to complete specialized training on how to provide peer recovery sources based on the principles of recovery and resiliency. They provide support to others with substance abuse or mental illness. And ways in which they do this are they have direct peer-to-peer services. They assist in the development of strengths-based individual goals. They serve as an advocate, a mentor, a facilitator for resolution of issues that a peer is unable to resolve on his or her own. They assist in the development of recovery goals. They develop a network of community support. provide information on ways to maintain personal wellness and recovery in order to provide wellness and recovery for the child. They provide information on how to navigate the behavioral health system, which is not easy, specifically for someone in recovery. They compare to 12-step sponsors and case managers they assist in an individual recovery plan, and they help to monitor that plan. They role model and they teach and coach on how to use the resources, because they themselves, as being in recovery, have already had to take advantage of those resources themselves. They encourage appropriate use of medication. They hold the person accountable for their actions. They model monitoring symptoms and our medication reactions. They provide lessons in effective communication with doctors and therapists. They model skills needed to gain employment. There's job coaching, resume building, and they teach recovery education and the vital importance of recovery education so that the mother can stay sober as well as assist her child. This video is a clip of we'll let you watch it later. This video is a clip of a peer recovery specialist in Tennessee, a former addict, and the link is in here if you would like to watch that. And I am going to pass this to Gabby.
So when looking at stakeholders for this program, we would be looking at affected mothers, exposed children, peer navigators, mental health providers, taxpayers, local community members, social workers, etc. And for instance, when implementing a peer navigation program to an actual agency, it would get more in depth with who we're using as our stakeholders in relation to that specific agency. Next slide, please. The economical, social, and political impacts of a program such as the one we've laid out for you would be long-lasting and would potentially expand over time. We would be seeing positive life alterations for affected mothers and children. This program has potential to create lasting effects on the affected mother's level of productivity in their community and local workforce, thusly altering the potential negative early childhood experiences of the affected children that can have adverse effects on a child's development later in life. And I'll pass this on to Miranda.
High rates of neonatal abstinence syndrome continue to torment the Central Appalachian region, contributing to an ongoing cycle of child behavioral difficulties and mental health problems that contribute to later drug addiction and subsequent NAS births. We must intervene early and provide a flotation device for mothers navigating their own treatment and treatment for their child at the same time to keep themselves and their child afloat to reach the shore of recovery and healthy development. I'll pass it on to Terry.
So what we've done, what we would like you to do per groups, for workshop groups, is to watch the following 2 videos. We're going to attach those on the next slide, and be prepared to discuss per group your response to the following question. Keep this in mind. Imagine you are the mother of an infant born with NAS. What services would you need to access in order to best serve the needs of your child and or yourself? Please have one representative from each group respond to the question in class on November 14th. The first video on the left is called Drug Dependent Infants Detoxing at Tennessee NICU. And this was actually from an excerpt from an ABC News series called The Invisible Among Us. And it was recorded at the East Tennessee Children's Hospital in Knoxville, Tennessee. And that's the perspective of the infant. The video on Heroin Kids, Doctors Help Children Impacted. This is from the Cincinnati Children's Hospital, the NAS clinic there. And this presents it in the perspective of what the challenges that parents face after birth to navigate the system and acquire services. And that could be for biological or adoptive parents specifically. And I will pass this to Emily.
So we've included all of our references here. And you can flip through, there are 3 or 4 slides of them. And so if you have any questions, please do reach out and we'd be happy to talk about any of the references that we've included. And with that, thank you so much for your attention.